Well, it's afternoon. Should we
You
get
guys
started?
want to get rolling? Sure. All right. Yeah, I figured with Coach John, there we go. We got some people joining. Awesome. I figured with a busy week. What up, John?
What's going on, family?
Hey.
Hey, John.
Hey.
Good to see you.
Your smile brings life.
How y'all doing?
Good. Good. How are you?
Oh man, I'm great. I'm busy, man, but I'm great. The Lakers won last night, so that's good.
We don't have to talk about that.
No, I'm good. I'm just busy, but I'm good. We had sonogram, so the baby's just healthy and like jumping around. Baby must have heard me yell rebound or something. He was moving his arms.
That's so great.
So so that's always nerve-wracking for me because it's just like I have no control, I have no say over that. So, but everybody seems to be good. Mommy's doing well too. So, so let's go. Let's ride. Let's do it.
Excellent.
Let's do it. All righty. Well, Coach Kibbs and I and Jane, we kind of got a nice little slideshow for you here, which I will move along. So we wanted to kind of tie in, because I mean, I feel like we're all living and breathing, no pun intended, COVID right now with our return to campus and getting students back on campus and just the news constantly 24/7. It's, someone made the point that like we're still in the first wave of this. It's not, we're not anywhere kind of towards the finish line, maybe. It's hard to see a light at the end of the tunnel, but we wanted to kind of come at it from kind of the sociological perspective and tie in our sports connections. So thank you all for being here. I know this is like the craziest week. We got pre-orientation, we got students back, prepping for classes if you're teaching. So it is kind of madness, but we really are glad to have you. And this is, I know for the Fab Five, kind of the most rewarding part of our weeks. And it's just a great space for us to share. And so we'll mute everybody, and video is optional. You can raise your hand to ask a question, or we got people monitoring the chat. So you can send a chat just to Jane as well. And she can monitor that, or Kibbs or me. We're happy to welcome a private question if you have one. But really it's just about making a space for us to share and communicate and maybe challenge one another if we need to. I think this is a good space for us to just have these deeper conversations and get a little bit deeper behind headlines, behind what we're seeing on social media and things like that. So with that, really wanted to look about kind of what we wanted to do today and to ask questions about racial issues and injustices as it relates to COVID, with, how we can really challenge our ideologies and think of our implicit biases and things like that. Jane or Lindsay, you want to add anything here before we move on?
I would say, go ahead.
Go ahead, Jane. Go.
I was just going to say this conversation usually goes its own way, and that's totally fine too. Obviously, everybody on who's on the call today pretty much knows that, but it's an open space for anyone to ask any questions, and nobody here is claiming expertise. It's an opportunity for dialogue, so feel free.
Yeah, and these slides are kind of just a guide point. Go ahead, John.
I have something I'd like to add to that effect. It's very interesting, the dynamic that we have created in the use of the Impact Chat. And I want to kind of give everybody else a perspective and share something from my new job at South Puget Sound. So they don't have anything like Impact Chat, okay? Let me just start out by saying that. There is a faculty / staff of color group, if you will, that has been assembled to talk about like how the college can be better about whatever as it relates to social injustice. And this group was formed because people of color were leaving, and then people of color were meeting, and that offended some people. So now we have this space where there are people of color who work there who are afraid to share their experiences for the backlash that they might get from other employees. So with that being the case, I just want to say, please take advantage and be mindful of the fact that Impact Chat is a safe, open place for dialogue, and understand that it is not this way everywhere else.
Yeah.
Yeah, thank you. And I'm actually going to share, now all of our Impact Cat Chats are on, they're all on YouTube, and that is, it's a public site too. So I'm going to share that link so everybody has those in case you want to listen to previous ones.
Yeah, we feel really, really lucky to have this. I mean, we started this, 3 months ago, and it's been so rewarding and so just great to have a mix of everyone from our community. And so we're really appreciative of people dedicating the time, and really want to keep this rolling into the fall too. So we may make some tweaks based on time and availability, but we definitely want to keep this going. So kind of an agenda that I had, or actually me and Lindsay and Jane put together, was kind of just inspired by Sean Doolittle and what he said about sports being the reward of a functioning society in this time of COVID. So we've seen, I think, a lot of sports maybe and a lot of schools try to restart and really run into some hiccups and some roadblocks and have outbreaks. And so thinking about how sports really are a privilege, and we are really lucky to, most of us, have some connection to athletics in some way, but how that so much of sport and social issues, so much of the social issues and the COVID issues can be kind of related to sport as well. So, and I also want to give a little background. A lot of people may be coming back to McMinnville for the first time. I know I haven't been in McMinnville until just about 2 weeks ago. And so looking at what the situation is here in Mac, and looking at other colleges, there's been a lot of news around colleges opening up. And then this ideal too, I want to make sure I think we all want to make sure that, students are coming back to campus, they're getting tested. If they're testing negative, that doesn't give them like a free pass, that they have to remember that like this is still something we have to keep under control and be responsible and be safe. And then kind of tying into the health disparities and how that relates to COVID and the racial issues there. And then back again to talking about professional sports and ultimately trying to convince everyone to maybe trust the science. And when it gets really tricky, when we have so many different messages going out there, so how we can kind of just rely on the science. So COVID and Mac. So I didn't realize this until I found this last night, that bars and restaurants must close at 10 p.m. regardless of the phase. But that's kind of what's going on statewide. Face coverings are required. Capacities limited for restaurants, gyms, and venues, and even face coverings were required indoor exercising or when you can't maintain 6-foot distance. And then the current case counts, we're actually, Yamhill County is really lucky in the larger scheme of Oregon as far as number of cases, but there is has recently been kind of this what they call community spread. And the stats on the right here are actually for Yamhill County, but McMinnville makes up the majority of that population. They said we are currently experiencing community spread within our community, which means people have been infected with the virus who are not sure how or where they became infected. With community spread, we need to remember the disease is in all parts of the county, and the advice of social distancing, staying at home, and hand washing would not change even if we knew every detail about each case. So I think that's a good reminder that no matter what, we still need to practice our social distancing and keep our hand washing, wearing our masks. And it stood out to me, the number of cases being in those younger populations, skewing to the younger 0 to 19, 20 to 29, 30 to 39, and then it goes back down and then back up again when you get to the the 80s and older. But just to give you an idea there just of the testing, and I know people have probably heard about some outbreaks with some of the elderly communities, like Rock of Ages was one that I saw some news about. And so it's definitely, it's here. I think back in March, we didn't really know if it was here or not. And I think now we know it's here. We need to be staying safe and trying to prevent that community spread. And even though, like I said earlier, even though we're kind of one of the smaller numbers wise in the state of Oregon, we still need to be, we kind of want to keep it that way. We don't want to, we're not trying to win this numbers race. And so Gibbs did a good job of kind of finding all the schools who have opened and then now have had to go back to online. So opening face-to-face. I have a personal story. I have a friend at UNC Pembroke, which is in one of the more highly affected minority counties in North Carolina. And they started face-to-face 3 weeks ago. So they started really early in August. And she said they felt like they started so early because like they knew they would get shut down. So they just wanted to start as early as they could. And then she had 18 students in one of her classes. And by last week, she was down to 3 face-to-face just because of the spread of the virus and people being in quarantine. And then you may have seen that the University of North Carolina, Chapel Hill actually shut down and went to online only for weeks. And it's been, kind of these stories popping up over and over again, and questions of like, why did they open in the first place, or what's happening, and things like that. And a lot of things have been traced back to off-campus off-campus parties. And the UNC chancellor and provost said they didn't even have the full freedom to decide whether or not to open the campus because the Board of Governors told the system that they had to reopen. So the people you would think that would be making those decisions actually weren't. They were kind of had their hands tied by a higher power. So, it's not as easy as, one president saying, yes, we're doing this with, on the public school side. University of Notre Dame was another one that had to switch to they said 2 weeks after a spike in cases. And really just seeing these spikes. And I think a lot of schools too are limited in their testing. That's one thing that I think we were really lucky that we're able to test these students as soon as they set foot back on campus and kind of get that baseline. And cases being like not only off-campus parties, but also Greek houses. My alum, my alma mater, Tennessee, our chancellor has been talking about how she's been driving around the kind of more off-campus apartments to check on students and make sure they're not partying, which is kind of ridiculous, but that's kind of the reality that we're at right now, which is pretty wild to think about. One other kind of egregious example was the University of North Georgia, where this image below, there was an off-campus party where obviously there's no masks, no social distancing, and then you can see Georgia, and a lot of this reflects too what states have been doing. So some of the states like Georgia and Florida, who have been really reluctant to shut down at all, their government and things like that, they've also been more reluctant to shut down schools, and not only higher ed, but elementary and middle school and high schools as well. Anybody else want to add anything here?
Yeah, I was gonna say too.
Yeah.
And we kind of talked about this earlier in the week, kind of playing the devil's advocate, like with these spikes and delays and stuff, like why come back at all if like this is what we're seeing, and schools that are delaying the start of school, I don't even really know why, just to like, in my mind, I'm like, make a decision, do what you're gonna do. But I think also it's kind of like I think we as a school have done a really good job to get people to buy into, hey, we can make this work if we're all in on it, you know, doing the mask, maintaining the social distancing, you know, just within our athletic department, and all of Doug's got all of the setup for us to protect us and our students from COVID. And so I definitely think it's doable. It's just, you know, there's a couple of things like, what's it going to take for students to realize that this is what we've got to do to stay safe, or at least to stay on campus, you know? And we can sit and talk about why come back to campus at all if we're seeing these spikes, and not everyone's going to be bought in, but, you know, I think we can do it. Like Jane said in the chat, stay positive by testing negative. You know, I think that's probably the theme for this fall, but it's not something to be scared of. You don't need to be scared of it if you're prepared, right? So
I stole that quote from you, Kibbs. That's still you. But yeah, Jennifer's asking a good question here too about the testing for faculty and staff. Is there anybody on the call who wants to address that? I assume we're talking about here, right? I can say what I know, but I wondered if anyone else on the call wanted to give any updates. Yeah, but it seems like, yes, staff and faculty testing would be a necessary thing if we are going to set a baseline. And I think that, I don't know, Jennifer, if you're asking about how that needs to be done or how that is going to be done. Yeah.
I guess I was just asking if. I know some schools have tested all their staff, and I haven't heard anything one way or another. And I know individually, if I've gone to my healthcare provider and absent symptoms, I can't get tested.
Yeah.
So.
Yeah, I'll talk to this. This is Janet.
Thanks, Janet.
So it's a difficult question. It's definitely a question that's being asked, and it's definitely a question that Susan AK keeps fielding, but there's definitely not been a definitive answer on how it's going to be handled. Currently the testing that's provided to students can't be offered to faculty and staff. That's what I do know. So they can't just blanket offer that. And it's something to do, I don't understand it completely. And it's something to do with HIPAA requirements. And so I can't answer to that specifically. What Susan AK I think is investigating right now is trying to get whether you can get tested at Kaiser, since we're all kind of Kaiser now in some way, shape, or form. We're all Kaiser. I know that one faculty member was able to go on the Kaiser website and just put that he has to get tested for work, and he was able to get tested. But when the college went to Kaiser and asked if Kaiser would test all the faculty or all the employees, they said no, we can't do that. So there's people who are getting it for free. He didn't have to pay anything. He didn't have to pay his copay, nothing, and got a test. So yeah, it's a great question, Jennifer. I wish I could say, yes, we're all going to be tested, and lots and lots of people are asking for it. I agree 100%. We should all be tested.
Jane, didn't you say in McMinnville they were doing free tests, kind of like a first come, first serve? It's a little risky, it sounds, but also there is that availability.
Yeah, that was at the Victoria Garcia, I want to say, Virginia Garcia.
Yeah, Virginia.
That was last week. I don't know if they'll do that again. But also, Doug, you found a place in West Salem that you could make an appointment online. You didn't have to have symptoms, right? You want to tell us about that place?
There's more opportunities to be tested in Salem because they have the capacity, because the hospital's right there too. But yeah, there's a place in West Salem that I signed up and did it online. Dwayne shared the different links, and I got signed up to do a test in a day. But I had to cancel because I got tested otherwise. But yeah, I think there's other opportunities outside of McMinnville that you can get tested.
We can share those links too. I had called a couple places here in McMinnville, and they weren't willing to have me get tested only because I'd never been a client or patient there before. But they were doing testing for people they've seen before. And for me, that's just because I just moved to McMinnville not that long ago. I've never been there, but that might work for some other locals. So I'll get those links into the chat.
If I could add back to the college thing, I have heard that some colleges, universities are suspending kids if they're caught in those party environments and not doing and following protocol. So, and I kind of shared that with some of our guys this morning that were helping me set up the baskets, that we got to take care of each other. You know, we're all in this together. You wear a mask to protect me. I wear a mask to protect you.
It's also one thing, I guess I don't know, I guess I'm not current on what our policies are for the students, but I've also heard some criticism, which makes some sense to me. You don't want it to be too punitive for students because you also want to be able to contact trace. And if they feel like they're, you know, going to be volunteering somebody for discipline, they may not want to share that information. Or any of us, I guess, would feel that way.
We, just Janet again, we talked about in the COVID committee meeting, recovery committee meeting this morning, we had Sean Webster on there, who's the ASLU president. And we talked about not making it punitive, getting their buy-in somehow, getting students buy-in, and how we can be, I mean, to use an overused term, how we can be all in, and how it's not about punishing behavior, but it's about understanding that this is something we all have to do or else this isn't going to work, and trying to provide that kind of approach to making it punitive.
And I agree, Janet, and we as an athletic department have talked to our head coaches and getting the message to our seniors, our leaders in our programs, because we can't control what's happening off campus, you know. So it's our peer groups that can reiterate the importance of face covering and physical distancing, you know. So if our peers, the ones that can buy into and understand how important this is, and they can put some in a positive way to their teammates or people on campus, hey, you know, we got to do these things, and we got to, you know, protect each other. And if I think it's coming from the peers is real critical, real important.
I agree, Doug. And also, you know, these are college students. So instead of saying don't socialize or don't do this, say, here's how you can socialize. Get together in a group of 10 people, make it the same people every time. Wear your mask, social distance. Here's how you can, and then we can deal with the drinking issue later. Like that's a whole nother issue. But you know, we need to address the COVID in a way that is manageable for them at where they are in their life, right? And we have to meet them there too.
Yeah, and I think that also comes from leaders too. Like as coaches are bringing back students and our student athletes, like I'm trying to think of, you know, what are physical distancing, team bonding activities we can still do so that they're still getting that like team experience. I wish some of our fall coaches were on so we could ask them too, because, you know, I think it's part of that culture building where we're gonna, if we just create a positive environment around something that could be really scary and instead just make it something like, you know, what we're just gonna have to get creative in terms of like how we are gonna keep our team still together, but in a safe way. And yeah, I think that just comes from our leadership.
Yeah, I agree. And I, you know, one of the things I really enjoy about athletics is you guys have the ability to communicate and ability to reach out to them. You know, how do we do that with the rest of the students? That gets really complicated.
Mm-hmm. Yeah. That's where our advising and all these little touch points, these wigs, like I put up on my first day of my wig, I was like, I'm putting up the rules here because I need them as much as you do. Like we're all in this together, and we're all just trying to learn and kind of adapt. And Esperanza was asking about the frequency. I had heard previously that we were going to try to do like 25% of the population, something like that, every 2 weeks, and then that way. And I have heard a lot about how you can do kind of these, I can't remember what, like kind of not a pod or not, but like having these kind of samples of
surveillance
that
testing.
Yeah, that you can helpfully be able to do more frequently. But yeah, because it like we said, like just because you test negative once, it doesn't, you know, a lot of us are going to the grocery store, or like there's just so many ways that this could be and it's not, one of my students also said, like, it's not like our campus is locked down. I mean, people can drive through even though you can't maybe get in the building, but so there is still the possibility out there. So it's just all of us, like you said, being aware and like finding ways to adapt the best way we can, and wear our masks at all time, and making the mask the new accessory, you know, that you can do. I'm thinking about doing like a mask making activity in class, you know, just trying to find ways to adapt to it. And I know, like, the thing is, I think a lot of people, like a lot of us, I know we've been frustrated or we've had questions, but it's just like, there's no one knows. It's novel. It's like, it's so new and it's so unknown that we're all just kind of trying to figure it out. And awesome, Jane, for sharing the testing sites, because yeah, it's I think it is really just evolving every day, and we just have to take it a day at a time. And I know a lot of faculty and probably staff too are just planners, and they like to plan, and like we like to have our syllabi and all these things, but I'm trying to get a lot more comfortable with, you know, just take it a day at a time. And I think it's been great to see our community really try to take on the challenge in any way we can, and really just try to serve the students. One more anecdote and I'll move on, but I had a returning senior, who was telling me about how when he came in March, or when March hit, he's like, I'll never forget, it was March 12th, everything got shut down. We had, you know, the extra week of spring break. I went home on March 24th. And I was stuck with my parents for, you know, in quarantine. And he was just like, yeah, I go from being like an independent college student to back at home, stuck at home with my parents. And he's like, it was really hard. Like, it was really, really tough, and mentally, and, you know, and it, you know, being super limited in what you can do, and just your freedom completely being taken away. And so he was just so grateful, and I think a lot of students are just so grateful to have an opportunity. You know, we don't know how long we can keep it, but we're gonna try our best. So I think at a certain point, it's kind of like risk reward, and we can talk about like the mental health aspects of this. Like, we're all gonna have basically PTSD from this. Like, this has been a huge life changing event for all of us. And I think the more we can just kind of acknowledge that, and really try to take a breath as much as we can, and kind of reflect and think about, you know, it really has, for a lot of us, I think, made us think about what we value. And I know just seeing students this past couple of days, even from a distance and things like that, but that's what we're all here for. I think it's for that experience, and masks and all. But to shift gears a little bit, I was gonna pull back up the slides here. See if I can get my screen share.
I was just going to comment on.
Go ahead, Doug. Yeah.
What Janet said, and I think it's a valid point too, is, you know, at times we all spend a lot of time with our students. And I was thinking, well, I've been an educator, and there are times where there's certain issues that I had warm-up activities before class every day. I mean, maybe it's 10 minutes, and just seeing how our kids are doing with certain things. And I think that's healthy, that even in that environment where you get to know your students a little bit better and see how they're doing, and maybe engage with the peers, allowing some time for them to engage and see how they're doing with things going on too. And I think that's kind of a creating an environment where even in the academia setting, where kids can feel comfortable talking about those things. So.
Well, oh, sorry, go ahead, Lisa.
So it's my first time here, and this is fabulous. I'm really glad I found out about it. You know, I just keep thinking about all the rules, and we're giving our students all these rules and restrictions, and you know, do this and do that, don't do this. And I think giving them a platform to socialize more, where we can hear what they're saying. And, you know, with so many things, when we need to solve a problem, we ask the students to come up with solutions too. And so they may have creative ways that they can experience, you know, that party feeling, or, you know, that freedom, or the, you know, personal feeling with their faculty, they probably have some really great ideas because they have all this technology and knowledge. And having a student who is right now at Linfield, he keeps reminding me that I don't need to keep telling him the rules. And you guys know, if you have teenagers, he's not stupid. He can read. He knows all the rules. I don't need to keep reminding him. And he's responsible. And everyone, I think our kids, they want to be responsible, but they also need to blow off steam once in a while. And I think we need to find ways for them to be able to do that are safe and somewhat controlled, and encourage them to do that, and encourage them to let us be a part of that with them if they will, so that we can have that, close relationship with them.
Yeah, I agree. Sarah, Sarah, with the ASLC, I believe they have different activities to create students to get together and do different things. And I only know one because I've helped her paint the graduation grounds. We just had it repainted again. It's a grid. It's about 90 feet by 120 feet. That's 6-foot boxes that we're painting. And they're planning to have, according to her, video, a movie night where kids could be social distant and be able to do some things. But I'm hoping, and a lot of these are all student run too, and their ideas are valuable. You're absolutely right. And then there's a group of kids that want to be here and they want to do it right, and they are creative in finding ways to do that. And Janet made the same point that we're always saying don't, but what can we do so we can enjoy each other's company? Yeah, I agree as well.
I agree too, Lisa. Thanks for pointing that out, because these are smart kids, right? They got into Linfield, they can figure stuff out, and they want to stay here. And we've been trying in athletics, we've been trying to really give kudos where it's deserved. We've had, I've been really impressed with our student athletes who have come to practice or called or texted their coach and said, I'm not feeling great. Here's what I'm feeling. What should I do? And just being so willing to report that. And then I talked with another student this morning who had a significant other wasn't feeling well. And so this student decided to quarantine, and just to be on the safe side, the significant other was tested, came back negative. She's good. But the anxiety that the person who quarantined felt just for 2 days waiting for that result. This is a lot of mental and emotional toll on people trying to do the right thing. And yet, we know from the formation of our brains that at the age of 18 to 20, we really need that social interaction, and we really need to be in person with people. And so I think it's almost like there should be a student committee on COVID tactics, or addressing COVID with having a valid and fulfilling Linfield experiences here. I think it's really good to get their input and to celebrate when people are doing things well too, because like Kib shared, we have actually over 500 people who, it's been negative tests so far, which is great. And so far nothing. And so can we keep that going as long as possible? It'd be great.
And when we do have a positive, we'll talk a little bit about like kind of the stigmas, but like I think we touched on it a little bit earlier, but when we do have a positive case, and like not making them feel like they're bad, or they're like, yes, they may have done something, that we still need to take care of them, right? Like it could be any of us. I think none of us are perfect. We don't live in a bubble, and we don't wear our little bubble hazmat suits. I think we're all trying, and I think even if it's going to be a fine line between like shame and making students feel okay, because as I'll talk about a little bit, there's kind of some groups are just more susceptible, and I think we still don't know like why some people get it and why some don't. Like I've heard blood type, I've heard all kinds of different things that can make this up. So it's yes, we want to encourage them to not do things irresponsibly and gather in good groups, but we also have to make sure we're not ostracizing them if they do get it, which is I think going to be kind of the next hurdle for all of us. And I do hope that we are able to get faculty and staff testing too, and maybe or we can kind of get creative and all kind of go out and try to find ways to get tested, and our capacity as a state will increase as well. So great stuff. I'm really enjoying. I think this is just a great space for us. Like you're talking about, like blowing off steam, and like this is, I think, for a lot of us, we kind of just want to talk about it without kind of a full-on agenda of like we have to answer these questions, but just raising questions. And I do think the students are kind of the key to this, like figuring out these different ways we can get creative. I did want to touch a little bit on kind of this whole culmination of COVID and protests and the kind of civil unrest and social unrest that's been happening this year. I found this article in the Oregonian that I thought was a really great article, and how it kind of exemplified these two huge kind of really life-changing events happening with COVID and with the protests that were happening, and really seeing that COVID is another example of how systemic racism works in this country, and how the reason why they're more susceptible is not just because of their DNA or not just because of their skin color, but because of structural inequalities and for the way that the system has kind of been set up against them. And I've seen this, the Native community, especially my tribe, was really lucky. They were able to shut down their borders and really keep COVID off our reservation. But the Navajo Nation, a lot of people there don't have running water. So it's hard to really, practice hand washing when you don't have running water, so it's simple, basic things like that. Really, a lot of people, I don't think, really consider. And so Black, Latino, and Native American people are nearly 3 times as likely to be infected with COVID than their white counterparts. And they're about 5 times as likely to be hospitalized and more likely to die of the virus. And you can kind of see the disproportionate amount here at the graph bottom. This is all from New York Times. And we can also send the links out to the slides and everything like that. But it is just overwhelmingly disproportionate for these people, for these groups. And I know for my own experience in the Native community, the numbers aren't even there. This population is so small that it's impossible almost to even gather them. And at one point, I think this was back in May, the Navajo Nation was basically the second leading, or third leading, if it was a state, it was the second leading state behind New York and New Jersey, and just the amount of cases, not even the proportion, but the amount. And so there's all different ways to kind of see this, but I thought this was a good representation of how this is so disproportionate among these communities. And why does that happen? And I think the healthcare and public health, there's a lot of ways that they may, I've heard stories of people of color going to the doctor and being told that their pain wasn't, they aren't being believed when they go seek healthcare. There's discrimination that happens in all these different pieces of the healthcare. And access alone, being from the South too, I know there's a lot of country, and I think this is everywhere in the United States. I think you can always find a country area where there's not good access to healthcare. There's not, driving distance. It makes it very tough. And how not only it's accessible, but how it's administrated. And also we've talked a lot about essential workers during this time. And how many of those are people of color, and how many of those don't have the choice to be able to stay home, to not work, but they have to go to their job at the grocery store, or at a hospital, or at one of these places where their work is deemed essential. And then it kind of all traces back to educational, income, wealth gaps, housing. We've talked about redlining on this before, but how these are all just other ways that health is impacted, and how it makes people more susceptible to COVID. Culturally, I think that for a lot of groups of color, housing is also, we often have multi-generational homes where you're not only just having your immediate, parents, kids, but aunts, uncles, grandparents, grandkids, all in one house. And that also makes it really hard to contain something like COVID-19. And then going back to kind of the racial, I thought this was an interesting little graphic here talking about how local governments, state and local governments that have passed or considering declarations that racism is a public health crisis. I think Kamala Harris, our new Democratic vice president nominee the other night, said there is no vaccine for racism, and I kind of love that quote. But the things is we can do is we can undo some of the policies that are racist, and how that can also be something that we can actively try to work against, and just try to really uncover the ways we've maybe had racism in these institutes and in these healthcare, you know, and it's, I think, again, not malicious. It's these implicit, unknown things that happen that against people of color that just become widespread. Kids, you want to talk about the stigma?
I don't really have a whole lot to talk about it. I mean, other than I just threw this up because we use stigma in a lot of different, I mean, to hear it associated with COVID, I thought was very interesting to me. And so that's why I threw kind of this definition up, just to provide some more clarity around how there is a stigma with COVID.
Yeah, absolutely. And like, you know, the fact, I think I've heard people say, well, Black people or Native people or Latino people, Latinx people are more likely to get COVID because they're more likely to have diabetes and be overweight. Well, why is that? Probably because they live in food deserts where they don't have the ability to get healthy food. And why do they live in food desert? You know, it's like it all can be kind of, I think, traced back to these systems and the systematic ways of how we've kind of divided ourselves among the country. And I think this too can really have an effect too once we start having students or faculty or staff that start testing positive. Like, I can't even imagine what that would be like, and how, you know, we don't want to like ostracize people. And you know, and I've heard a story about how one of our baseball players already had it back earlier in the summer, and you know how big of a struggle that was for him. But now, you know, there's still questions of like, well, is he immune, or do we know if you can get it again? And like, so it's like there's no kind of this idea of safety, I think, is really interesting. And when it's tied in, when you think about the social aspects and racial aspects and the stereotypes and things like that.
Well, and it also just really exposes kind of back to the systemic racism too, where there's just like another layer to kind of peel back around. And like I posted in the chat the article from the Willamette Weekly that was just talking about how COVID has exposed these underlying conditions for people of color because of COVID. And that is all kind of related to, you know, looking at, and this is just specific to Oregon. So, you know, where people are living, where they're coming from, what they have access to.
And I think too, like this underlying anxiety about COVID, or, you know, you imagine like this student who was really stressed for 2 days being quarantined, and that sustained anxiety, we can all understand that because we're all experiencing that. And then you add race to it, and you imagine the sustained anxiety that a person of color lives with on a daily basis, faced with racism. And you think about like how much that impacts our immune system and our ability to stay healthy and our ability to bounce back from infection. It's just like, it's terrifying, honestly.
Especially when you're alone and you're being told not to socialize, and then you can't talk to anyone, right. And you're just alone with your thoughts in your head about everything going on, right. And it just like compounds, and it gives me anxiety just thinking about that. Like,
yeah, it's a good case for yoga all the time. Yep.
Yes.
Jennifer,
outside and socially distanced.
Oh, you're muted. Jennifer, are you going to say something?
Oh, no, but I was just thinking, anybody else thinking of, we're talking about the stigma associated with COVID and the intersection with racism, but it is, I always come back to the fact that it all is so bound up on how we think about illness and getting affected across the board, because we just tend to blame the individual, don't we? As Americans and the American culture, because, you know, oh, somebody gets cancer, oh, they smoke.
Yeah.
You know, or they were overweight, or, you know, and that's, as you say, no matter, that's everybody. And then you add race and wealth and all the other factors on top of it, and frustrating. And this is not a new issue. I mean, I don't think any of you were saying it's a new issue, but the systemic racism of the healthcare system. I know my mom is a long retired professor of nursing. She says, I can tell you papers we read in the 70s, you know. I'm sure there's papers back to the 50s talking, maybe not the 50s, but I don't know. I have no idea on that sense, but this is exposing things, and maybe this is yet another moment to try to make change.
If anyone reads Brene Brown, Nat, I was just reading her Dare to Lead book, and she was talking about like daring leadership, and, you know, once you start playing like the shame and blame game, you know, that's where you are just like being a cancer kind of for everyone, as opposed to being able to be that leader that can kind of step up and help people feel somewhat comfortable in a very vulnerable situation. So going back to COVID, you know, it's like not being afraid of it, but being able to just kind of like step up and help people not feel alone in a time when we're supposed to be alone.
Yeah. And I think that's another big point that's been made about the protests and about this kind of uprising. Like we didn't really have a choice to not, like, we weren't able to go to the movies. We weren't able to get away really from the things that were happening. And we didn't have the distractions that we normally would have. And I think we were definitely forced to think and talk and, you know, have these deeper conversations, you know, just because we are kind of all put in this our own personal little bubbles, and with technology now, you know, it's never ending. You're going to see it if you're on social media, or even if you're watching the news. Like it's not going away. And I had one last slide I can share, just talking about, because I think I kind of always look at the sports angle too, because I think sports has taken a ton of news around this too. And there's, you know, questions of like risk and benefit, and, you know, the kind of corporate angle too of what's you know, what's the role here of the business side of sports and versus like athlete well-being. And so we've seen some really successful things with NWSL. And one thing that always bothers me is, you know, the NWSL was the first major pro sport in the United States to come back. And then it wasn't until like other sports started playing and they're like, oh, the first sport's back. And everyone was like, well, NWSL was playing, you know, just because it's a women's sport doesn't make it not, you know, a valid sport. So
sorry,
that was a lot
non-athlete here. What's NWSL?
No, totally fine. National Women's Soccer League. So the women's soccer. So, and it was they had their kind of bubble in Utah and early on, and people were kind of, when they would say, oh, it's, you know, finally we have sports back, and the NWSL had been playing for a week. And so, yeah, those kind of like subtle sexism and leaving out of women's sports, whole other CatChat for us, I'm sure, talk about women versus men in men's sports. But the NWSL had a really successful they did a kind of a cup, not a World Cup, but a kind of a mini cup there in Utah. NBA and WNBA have created their own bubbles in Florida, where they've been pretty successful. They've had a couple of players that needed to quarantine because of and it's been interesting to see the stigma around that too, when athletes are, you know, going and doing things maybe they shouldn't be doing and then being placed into quarantine, or athletes just simply choosing not to participate because of their families. And how I wonder that kind of the stigma too of like, you know, how weighing their health and their family's health over the playing and the love of the game, or their paycheck and things like that. And MLB has been kind of one of the examples, maybe not what to do, just because they didn't do a bubble. They were basically trying to play kind of more normally, a shortened schedule, but they've had outbreaks, teams like the Marlins in Florida. So not only were their team affected, but the teams they had just played, the teams they were getting ready to play. So there's been all these cancelizations and postponements, and until they can really get that under control. And some people think that this will cause limited access, not only for fans, but for media. Because that's been a big thing with pro sports, is the media being right there in the middle, and the reporters and journalists being in the locker room after games and things like that. So that might really be a shift that we'll see in the future. And just talking again about athletes and how they kind of make that decision between the risk versus the reward. You think of some players in the minor leagues who weren't able to play and who needed that opportunity to try to make it, to get to the big leagues. And then, some of these players who are making millions and millions of dollars, who have the ability to kind of just take a season off. So, and it trickles all the way down to our college kids, and to thinking about Olympic athletes and things like that. So I could really honestly teach a whole class just covering COVID in sports, because it's been one of the really big shining kind of examples of how this is manifested in our society, because sport is so ingrained. And again, like Sean Doolittle said, it's like, sports are a reward. They're not a given. And so I think some of the people behind with the money are trying to push, because they're losing out on sponsorship dollars, or they're losing out on ticket sales. But is it really the right thing to be doing right now? So just some interesting thoughts there, if anyone wants to add. I think Hibbs has some thoughts.
I don't know if anyone else has any information about this, but I think I remember, like, back in April or May, didn't the MLB weren't they kind of like a testing ground for COVID too? Like, they were kind of I want to see if I can find it real quick. They were kind of having, like, any players and any administration, we're going to continue working, but with, like, in their own bubble, and in spite of COVID, but, like, they were, like, willingly volunteering to be exposed, basically. Anybody know what I'm talking about?
I don't remember that, but while you're looking that up, I mention too, like, at the college level, there's just the culture on the team is so thick. It is so thick that it's like, those of us who are athletes, you have each other's back. You're ride or die basically on that team. And so I saw it the other day with just like, it's hard to, the wearing masks it feels intuitively wrong when you're saying, but you're so close to me, you're family. And then it goes back to that idea of we need to determine who our inner bubble is, right? And always be able to name those people on one, maybe two hands. But I was in a conversation with Gary and Joni Claypool, and Joni is one of Gary's athletes, right? And so we're in his office and we're like, okay, mask up, and he's like, oh, but she's family. And it's just it's that feeling of like, and I'm like, I know, but we're not in each other's inner bubble. We got to do it. And it's just like, it's so counterintuitive and sometimes. And so you look at, that's those of us trying to make sure we're creating a climate on campus of everybody doing this. And then you look at athletes at 18 to 22 and you're just like, oh my gosh, it's so hard. It's so hard because they just want to be there for each other and be that, be a team. And that it's difficult. It's really challenging. And that's not even paid athletes. None of our athletes are paid. So.
Yeah, that's where, gosh, we could do a whole thing on like call it, because like there's been all these issues with amateurism and the power that college athletes have, and some of them are put in some very interesting positions. Lindsay just sent along there. Yeah, there was the antibody testing, And one thing early on I remember was that people were wondering, like NBA players and MLB players were all getting testing very easily, the NBA especially, when that happened in March. And people were like, when the general population didn't have that access to testing. And so a lot of people are like, why are these, athletes, millionaire athletes getting access to testing when other people aren't? So there was definitely some issues there. And because the NBA actually shut down when one of the players had COVID, and he had just mocked it earlier that week. It was such a wild couple of days. And I think it continues to show some of the issues in sport. Like I think most of us love sport, and we hold sport up as like, there's so much good that can come from it, but we also have to like think about, okay, what are these systematic, just like the racial stuff, what are the systemic things that are happening here that maybe this is a time everyone keeps talking about creating like a new normal. What are the ways we can change things for the better?
The new normal.
I'm going to throw this out there as an idea so we can do it at some point before we end this conversation. Can everybody, if you're willing to put your camera on, just take a group photo with your mask on so we can share this. So be one of our.
Wait, hold on. I got to get mine. Hold on.
Okay.
Esperance, so we want to see you.
I'll pass today.
Huh?
Aww.
All right. Woohoo! There's Lisa. Nice.
Hi, Lisa. Jennifer's grabbing hers, I think.
Oh, there's Kalia. Nice to see you. Awesome.
Yeah.
All right, wave. Nice. Perfect. Thank you.
Wait, we got John now. Maybe do one more.
Oh, wait, one more. Okay. Hold on. All right, wave. Cool.
Awesome.
Thanks, guys.
I'm smiling with my mask on.
Yeah.
It's all about smizing.
I checked my smile just now in the back, like earlier this morning in the bathroom, because I'm like, when you do smile eyes, and thank goodness for laugh lines, right? Because it shows you're actually smiling. So I was doing smile lines, and then I pulled it down, and I'm like, that is such a lame smile. Like, it's so bad. Trying to get my eyes to look like they're smiling doesn't necessarily make for a great smile, but.
And Esperance, we'll just Photoshop a little mask on you, on your little icon.
Yeah.
Really perfect.
Yeah.
Awesome. Well, that is all I had to like formally kind of present, but I'm so appreciative of this group and this time that we have.
And well, yeah, and we're out there on social media and hashtag mask up, do a selfie, do something, put it out there, and let's keep this going as best we can, and keep giving kudos to people who are doing, everybody's trying to do a good job, and let's keep giving shout outs, because this is our biggest challenge.
I wondered if I could ask this group a question, because I've had this, the one thing, having been on campus most of the summer, and we're all masked up, and as far as I can tell, all the staff and faculty that have been around are doing a good job of staying masked, but I realize there's a whole lot of new people on campus. Mm-hmm. And with the masks, I genuinely have no idea who they are.
Yeah.
And I noticed that for greeting new students, there was this sort of hop into 30 minutes, shuffle everybody for 2 minutes to meet people. I wondered if anybody'd be interested in doing that for like employees, faculty, and staff.
Oh, yeah, we should.
That's a great idea, Jennifer. We should, Amy Scholler might be able to organize that, since she and Katie organized the first one. So.
Oh, did they? Okay,
yeah,
I did not know.
And if you were at that one yesterday, which I was, it was mostly faculty and staff. We were all
really?
like running into each other. I talked to
a few
students, and I talked to 4 faculty and staff. So we need more students.
Lisa, what department do you work in?
Advancement.
Oh, nice. Okay. Good to know.
Yeah. My son was on it yesterday. He's an incoming freshman, and we got connected. That's how few students there were. So yeah,
Well, of course, part of the problem
too.
I was just going to say, part of the problem with things being random, truly randomly, you could end up, there could have been a lot of students there and you just didn't meet them, but I don't know.
I did look at the list because I like you, I am based in data.
Hey, and having Kalia on here reminds me too, I wanted to share this with at least everybody on this call, is that according to Patty, Dwayne, and Gary and the NCAA and CDC requirements, it's okay for runners to not have a mask on. So if you see a student who's running, it's okay for them not to be wearing a mask.
Good to know.
They stop, they got to cover up, or if I've seen them when they pass you, they've cover up. But
Hey, I want to go on and say, you know, every now and then I'll get somebody who'll make a comment that, oh, I drove by campus and I saw students without masks on. Here's the deal. Being outside, if you're greater than 6 feet, it's not actually required to wear a mask unless you can't maintain that social distance. And, you know, although I'd prefer people to wear, in my outdoor class that I just taught, I had them wear masks the whole time, regardless of whether we could social distance or not, because I'm there and I want to be as safe as possible. So I just mandated that to that class. But we do need to keep that in mind. If somebody's outside and they're more than 6 feet apart, they don't actually have to be wearing a mask. It's still recommended and it would be better, but they don't actually have to.
And we've run into that with a couple of students too, where two people walking side by side, no masks on, and we're like, you guys need to have masks on. They're like, well, we're roommates, but nobody else knows that. So you still need to, like, you know, and while we all are getting into the habit, let's just, you know, put them up if we can. It's nice to be able to remind each other and to I mean, hopefully we can all remind each other nicely, because I have definitely walked out of my office to get water and forgotten to put my mask back on. I'm like, oh shoot, okay. So hopefully we're all, you know, trying to get in the habit of doing it.
I did see a recent sweatshirt where the mask is built in, so you could just have it. It's actually part of the sweatshirt, so then you can just pull it up. So yeah,
nice.
There you go.
I definitely want to invest in that.
That way you're not forgetting your mask, right? It's always there.
I think Linfield has done a fantastic job of getting masks to everybody across campus. I've talked with some other athletics people, and they're handing out paper ones, and those are useful. They're helpful still, but like, we got some swag, we got some style on our masks. I really love it. I love how quickly we got that done. Thanks.
I need to get one.
Yeah.
Yeah. I kind of think of it like chapstick. I try to keep one in like every location I am. Like I keep one in my car. I keep one in my at my desk, at my house, right when I walk out the door. It's like and I'm telling you, it's gonna be the new accessory.
Yep.
Again, our age is your reading glasses. You got them in your bag, in your car.
Yep.
Nightstand.
Doug, are you in your 50s?
No way.
Yeah.
Kalia, not to put you on the spot, but how's it going?
Going well. It's been a busy but really fun week with our Wildcat interest groups, doing first generation sessions. We'll have a busy weekend ahead of us. Yesterday we had our first gen social. We had the boba tea come. And then on Sunday, so it's going to be pretty fun.
That's awesome.
Can anybody get boba tea when they come to campus? Are they coming again?
Yeah, anybody can come on Sunday.
Oh, nice.
Close the event, my friend. It's for the first gen. Are you first gen?
No, but I love boba tea and I love students.
Okay, we can only have 100 people. We are modeling safety. We can only have 100 people at your event.
Okay. It's all right. I can walk to the cart from my house, so either way.
You are welcome. I've been telling my students that our role is to model safety in all capacities, and so because perception is important. So you may be safe, but others don't know, like what you just said. So let's just model it.
Okay.
Yeah, I walked by last night. I was walking my dogs, and I saw the boba tea, and I saw the group, and it looked like it was they're doing a pretty good job of socially distancing and all masked up. So that was cool. It was cool. It was just like, I was like, I'm used to, like, I've seen the food trucks last year, and I was like, it felt like a nice sense of normalcy.
Yeah, I think the students did that. Like, yeah, they did a really good job of keeping their masks on, especially when they weren't drinking. But yeah, I was like, it's just nice being out here. I feel like this is the most normal we have felt in a while. So it was pretty cool.
That's great.
Awesome.
And you
I
have,
have an idea.
yeah.
But this was totally different about the phrase. I think we should do something about it and make it like a way of life. You know, stay positive by being negative.
Yeah.
I don't know how to amplify that. I think I just think about it right now, and I'm like, we can amplify that phrase, and I don't know, but let's look into it.
Okay. I like
Yeah,
it.
I'm trying to get Lubble going. I'm trying to make Lubble a thing. Linfield bubble.
And
Protect the Lubble.
Stay positive. How does it stay positive, be negative? I can't
Test
remember.
negative.
Test
Stay
negative.
positive, test negative.
Staying positive by
I worry a little
testing
bit-
negative.
I worry a little bit about students who test positive, and
Right.
if that is a negative message to them. I'm sorry. I just had to.
No.
It's been resonating with me.
No,
Yeah.
I agree
Test
with you.
negative. What does that mean about me if I'm? So I worry about that.
Especially because you can be asymptomatic. We talked about that. Like you just don't even know that you are positive, right? It's like that's what makes it kind of unknown and a little can be scary.
I like the message. I do. I love the message. I just yeah.
Yeah, that's a good point, Janet. That's a very good point. Yeah. Thank you for bringing that up. I appreciate that.
Yeah.
We went a little bubble, and then we realized we got to get out of it.
Absolutely.
All right, I gotta get going here.
Awesome. Well, thank you, everyone. It's been really nice having you here. It's great to take a break from all the madness of this week. And it's an exciting week. It's a very exciting week, and it's been stressful too, but it's good to just have a nice, calm conversation with everyone. I appreciate it.
Yes. Thank you all for joining us.
Yeah, thanks
We'll
for
be back
doing-
next week.
All right, I'll pass the word.
Awesome. We'll see you next
Thank
Friday.
you.
Oh,
Hey,
everyone.
everybody. Thank you.
Bye.
Keep well. Bye-bye.